Welcome. I'm Judy with Hope Dementia Ministry, and this is Understanding Dementia-Related Behaviors, Part 2. We're going to pick up with the next topic, which is incontinence. Sometimes as people develop dementia, they simply can't find the bathroom. Their spatial memory is lost, and they don't know where the bathroom is. They don't give themselves enough time to get there. They get confused about the snaps and hooks and zippers and whatnot on their clothing, and so they tend to have accidents. So there are some simple ways that we can avoid this part of the issue. One of the things that you want to do is to establish a toileting routine. So that means you want to take someone to the bathroom on a regular basis. You want to give them the ability to do as much as they can by themselves. We want them to have the most independence that they can for as long as they can. So if you set up a routine where you're taking someone to the bathroom on a regular basis, then they don't have to worry about finding it when they need it, recognizing the urge when it's time to go, and that sort of thing. It can be built into your day. People should have activity every day. They should be getting up out of their chair and walking around every hour or two. So you can use this whole trigger idea about behaviors as part of this. When you get up and walk around, you change position, you can move around a little bit, you get some blood flowing, and look at this, we're walking past the bathroom. Maybe that will trigger them wanting to go to the bathroom. So the more that you do this and get into this routine, the better it's going to be for everybody. Learning their behaviors is another important thing. Do they fidget? Do they jiggle? Do they pick at their clothing? What is it that tells you, oh, they may have to go to the bathroom? Because remember, people can't always express exactly what they want to tell you. Interestingly, one family told that their dad would say, I need to go home. And they discovered that that's what he said when he needed to go to the bathroom. And they don't know why that was the thing. Maybe it is because, going home is comfort, and, some people can't use the bathroom away from home. They can only do it at home. So whatever it was, that's how it came out for him. When he said, I need to go home, they knew that he meant he needed to use the bathroom. Clothing with simple closures, elastic, like no closures at all, just up and down, or Velcro, or something really easy. We don't want people to have to fiddle with belt buckles and hooks and zippers and all that kind of thing, because that just makes them more frustrated and they can't do it on their own. Avoiding liquids before bed. Okay, so sometimes people solve this whole problem by not giving the person a lot to drink. That is not a good idea. We need to keep people hydrated, because keeping people hydrated keeps everything else working properly. So that is not the solution. Now, you don't want to give everybody a great big drink of water before they go to bed, but making sure that they get adequate liquids during the day is a good idea. Limiting liquids just before bed is another good idea. But also keeping waterproof pads on the bed, on the living room chairs, on the dining room chairs, just to avoid those kinds of accidents. And comfortable, discreet adult briefs are on the market now. There's just wonderful products that are out there, and that's something that everybody should be taking advantage of. Now, there's some other things that can limit people in their use of the bathroom, and that, again, is visual. If someone has dim vision and you walk into a bathroom that's mostly white, and the tile is white and the toilet is white and the wall is white, it can just be a big blur and the person can't see where the toilet is, and it can be dangerous to try to sit down and the toilet's not there where you thought it was. So one solution to that is a nice bright red toilet seat. Just like we talked about with drinking and eating, that contrast can be very helpful. And red is a color that people with the dimming vision can still see very well. So when you put a red toilet seat in this whole sea of white, it pops out like a bullseye. And there you go, there it is. Um, Sometimes people have problems with their loved one urinating in the wrong place. Often this is happens like in the bedroom. People might get out of bed and urinate in the closet. Um, Sometimes men might urinate in the trash can or in the sink. So when we think about behavior wise, what is that telling us? Well, if someone has worked in an office building or in a setting where for most of their life they've been using a urinal, then standing up to urinate into a urinal might be the thing that they think they're doing. So there are urinals that you can retrofit into your bathroom that to give them an option. Um, but again, the red toilet seat creates a bullseye that they can see and something to aim for. So that's something to keep in mind. If your loved one can't find the bathroom, it's good to put a sign on the door. And you don't necessarily want the sign to say bathroom or restroom. You want it to say toilet. People need simple words people can still read and interpret. So a big red sign with a white toilet on there, the word that says toilet, indicating that that's where the bathroom is, can be helpful. Another big issue for people is bathing. It's one of the biggest things that I get questions about at personal sessions or phone calls. How do I get them to take a bath? Well, there's a lot in this issue. Sometimes, if we think back for the older generation, when they were growing up, when they were younger people, you did not take a shower every day. You maybe only got a bath once a week when they were little kids. And so they might be saying to you, I didn't do anything. I didn't get dirty. Why do I have to take a bath? But if it's an issue of body odor or something like that, then you have to keep pressing to make this happen. But let's think about what taking a bath or taking a shower. Maybe you can't get into the bathtub. Maybe you can't get sitting down into the bathtub, you'll never get out again. And also, the bathroom is where most falls take place. It's a dangerous place. And even if we can get beyond all that, we have the non-skid things on the bottom of the tub, and we've got the chair that slides them over and they can sit. And then there's the whole issue of the water temperature. When you turn on the shower as a caregiver, you reach your hand in, yeah, that feels good. But if you have ever done that for your own shower, and I do every day, put my hand in the water feels good. But by the time I get in there for it to spray on my body, it is not the right temperature. Generally, it's too hot. But I know to step back and reach for the knob and which knob to turn and which way to turn it. But if I am suffering from dementia and I get in there and I feel, no, no, it's burning me, and I can't figure out which knob and I can't reach over there, it's going to be a very difficult situation. And I'm going to want to walk away from that and not participate in that again. So, it takes a little bit more finesse to make sure that this is happening in the right way. One of the things that we also have to consider for people is modesty. Bathing is something we do by ourselves. It is independence, it is personal, it is private. And so now having to have someone help us do that is not something that we want to be doing. I don't want my son or daughter giving me a bath or grandchild giving me a bath. And so we have to think about a person's privacy and modesty. So one way around that is to use great big bath towels, bath sheet. It's even bigger than a beach towel. Wrap it around the person. Make sure the bathroom is warm so that as you undress, it's still warm in there. And when you come wet out of the shower, Even a warm bathroom can feel cold. So you need to heat it up nice and warm. As the caregiver, you're going to be too hot. If you are not too hot, they are going to be too cold. So have the towel draped around, undress from under the towel. This maintains the privacy and the modesty for the person. Help them into the bathroom. They should be seated um, so that they don't lose their balance or something like that. If someone is at the point where they need that much help, they definitely need to be seated. You can use a handheld shower head. They're very easy to install. They are not expensive, but they are indispensable when it comes to helping someone shower, especially if you're trying to shower them while they are under a big bath towel. So the sprayer can go under and you can give them the soap and the washcloth and ask them to wash different parts and spray it off. Yes, the towel is going to get soaking wet, but that's fine. When the shower is all finally done, you can bring in another dry one, drop the wet one, wrap them up in the dry one, move them out into a nice warm bathroom where they feel secure and safe. You have to go slowly at this. This can't be a rushed process. If you are upset and agitated and not comfortable with it, they're going to be upset and agitated and not comfortable with it. So we have to really think about what is calming, what will make the whole situation calming. Maybe it's music. Music is a really important tool to help people through lots of different kinds of activities. Put on music that they enjoy, something peppy, something that's uplifting, something that makes them feel happy, or something soothing, something meditative. Maybe light a candle, make it spa-like. Think about making it an enjoyable process. If it is just a mechanical procedure, it's not going to go well. Um, and as a very, well, not necessarily a last resort, but sometimes when we think about where are people comfortable undressing, the doctor's office, the doctor in a lab coat, a nurse in scrubs, these kinds of professional settings. So a lot of people have gone to hiring an outside caregiver to come in who's dressed professionally um, in scrubs. And this is their job to come in and do the shower. Often people are much more cooperative for a stranger who is dressed in scrubs than they are for their own family. So if this really the resistance is that they don't want a family member bathing them, think about taking this option of having a professional caregiver come in and handle that kind of thing. And if a person is not having big issues with incontinence or something like that, then really a good once a week shower is all that they need. You can do spot bathing in between, you can do hair shampooing in between, that kind of thing. But if they're getting a good shower once a week, that really should do it. Um, so, if you absolutely can't get them into the tub anymore, if that's not something they're physically able to do, and you don't have just a walk-in shower or a roll-in shower or something, you may have to resort to sponge bathing. And, no one who's been in the hospital for any length of time has not experienced getting a sponge bath. Um, it's very modest and private. You can keep everything except the one area that's being cleaned, covered up. And so try to be creative. Try to think about what it would be like if you were in their place, if you were the one that this was being done to. Think about what it's like, if it was being done for. And again, trying to make it a lovely experience, a spa experience. Maybe it's followed by a hand lotion massage on feet. That can be a very good, pleasurable experience. But just the yelling and screaming and rushing them in and forcing them to take a shower, those kinds of techniques really don't work. I generally share a story about my grandpa. He shared with us, he lived with my parents the last years of his life, and she would insist that he go in and take a shower, and he didn't think he needed to take a shower. So he would go into the bathroom and turn on the shower and sit on the toilet seat, and he would just wait it out. He would take his towel and he would throw it up against the water a little bit so that the towel was damp. And then he'd turn off the water and he'd spend a little more time in there. And then he'd come out and no one asked him any questions. So people, they can get around this. If they don't feel they need it. So one lady was telling about her husband. He didn't want to shower and shave, and she couldn't figure out how to get him talked into shower and shaving. So she decided to bribe him. He loved to go out to dinner. So she said, if you shower and shave, we'll go out to dinner. Okay, he went right in and showered and shaved. We have to be creative with how we are dealing with people. And, I hear a lot of people say, well, you don't want to treat them like children. And I think, okay, I'm not sure how that person treats children, but children should be treated with dignity and kindness. And that's how we want to treat adults. If they're talking about children being, you do what I say because I'm the boss, if that's what you think of as treating someone as a child, okay, then yeah, you don't want to do it that way. But if you can think about how do you get a child to do something, how do you talk them into it? Maybe you do bribe them. Maybe you make it seem like it's more fun than it is. Ooh, this is going to be so fun. That's how we get kids to cooperate and do things. So if you can apply those kinds of techniques to older individuals living with dementia, what is going to make them want to cooperate with you? It's going to be more the kindness than the ordering them to do something. It's doing it on their terms, doing it the way they want to do it. And again, asking them for their ideas. How would you like to do this? What would you like to listen to? What scented candle do you like? So letting them be part of the decision making can put them in a much more cooperative mood. So once you have your loved one bathed and clean, then we move on to dressing. Dressing can be a difficult task for people. If you arrive and your dad is still in his pajamas and you have a doctor's appointment, and you're like, Dad, go on in and get dressed. Hurry up, get dressed because we have this doctor's appointment. And he's in there and he's in there and he's in there for a long time. And you're urging him, are you ready yet, Dad? Come on, are you ready to go? It's almost time to go. And he comes out and he's got a lot of clothing on, several shirts, a couple pairs of pants. And you think, what is going on here? Or he comes out and something is on inside out, or he comes out and he's still in his pajamas. We think, okay, then let's break this down and see what the issues are when someone is trying to get dressed. The first thing could be the process. Everything we do is a process. So he doesn't know which clothes to pick out. What goes on first? What goes on next? How do you get them on? This is where people sometimes get to the point they seem like they can still do things for themselves, but there's a glitch in it. Or someone who comes out with lots of clothing on, they maybe opened their closet doors and there were so many choices that as they look through, they became triggers. So, oh, I like this shirt. I'm going to put this shirt on. But then as he looked more, he goes, oh, I like this shirt. Well, there's another shirt. That's another trigger. I put on another shirt. So some of the ideas for solutions for this would be to lay out. If your loved one is to the point where they can't choose things to wear, you can lay out their clothing on the bed, something like that. Coach them. The underwear goes on first. The pants and shirt go on top of that. It's good to give them choices, rather than just say, I said this is what you're going to wear. You could lay out a couple outfits. Maybe your mother has been very particular, or your wife is very particular about how she dresses, but maybe she's putting on something in the wintertime that's actually a summer outfit. So get out of the things out of the closet that are not in season. maybe isolate down to just a few outfits so there's not so much choice, it's not so overwhelming. Maybe lay out two outfits on the bed. Do you want to wear this one or do you want to wear this one? So they are still in control. They are still making some decisions for their life. Um, Keeping the clothing simple. Again, that means, not a lot of fussy suspenders and belt loops and belts and zips and hooks, but pull on and Velcro closures, making it simple so that they can handle it by themselves. If they do happen to come out dressed in some way that you do not find acceptable, remember what you thought when your child was young and dressed themselves, and you said maybe they're just expressing themselves. Sometimes we have to let things go. If we're not happy with how the outfit looks, it doesn't really matter. They got themselves dressed. They are independent in that way. It doesn't really matter if the clothes match or don't match. Um, and the other thing about clothing that's inside out, if someone is still doing their own laundry, one of the early telltale signs of dementia is someone wearing their clothing inside out or backwards, because it can be confusing when you think about when you take something off over your head, often it turns inside out. The method of getting it back turned right side out can be too complicated for them to do. And so they might just wear it inside out. They might not even notice that it's inside out, that there's a tag sticking in the front. So we have to be, cognizant of that and let it go sometimes. Um, so apathy is another symptom, another common issue that has been given the name of apathy. But what I want to suggest is that it's not so much that people don't want to do anything anymore, because that's what they'll say. People will say, well, my dad just doesn't want to do any of the things. My mom doesn't want to do any of her hobbies. They don't want to do anything anymore. And it's not necessarily that they don't want to. What it is that there is a process to everything, and there may be glitches in that process. And when we think about processes, and this is another thing that really gets in the way of personal hygiene care as well. It's the process. Everything we do, we have learned to do from the time you were a little child, and it's a process. There's a lot of steps. Think about brushing your teeth. If you took every little step of that process and put it on a separate Post-it note and put the Post-it notes across your mirror, you'd see there's a lot of steps to brushing your teeth, from taking the toothbrush, taking the toothpaste, take the cover off, put the toothpaste on, put the cover back on, all those are little steps. And what happens to people is that sometimes a step is missing and they just can't skip that step and carry on with the process. And so if they've got the toothpaste on the toothbrush, but now they don't know what to do with it, they may put it down and walk away. They may figure out something else to do with it. Well, I know it's for cleaning. Maybe it's for cleaning the faucet. And you walk into the bathroom and now the faucet is covered with toothpaste. One of the ways to get people through something like that is, again, to do it with them. Just like the eating, we talked about mirroring. So if you stand and brush your teeth with your loved one while they're brushing their teeth, that gives them the cue. Oh, that's right, that's right. The next thing is we rub it around in our teeth. Then you spit the foam in the sink. Oh, that's right, we have to spit that out. Well, what if you weren't there to spit and they swallowed it? Like, oh, that was not a good experience. I don't want to do this anymore. So that's what's happening when we experience apathy with our loved ones, is the process becomes too complicated. They can't do it, and so they just walk away and they sit in their chair and they turn on their TV because they can do that and they feel comfortable doing that. So instead of saying, well, my mom doesn't want to garden anymore, I tell her, it's a beautiful day, go on out and work in the garden. No, she doesn't want to. But if you go with her and you get the little claw out and you pull some weeds, or you take a little shovel and a little flat of flowers and you dig a hole, then she sees you dig a hole, she can dig a hole, put the flower in, go through the process. So sometimes people need that step to be suggested for them. And if you're there doing it with them, you don't have to say what the next step is. Okay, mom, now you dig a hole in the ground. Okay, mom, now you take the flower. But if you're there doing it next to them, then that is the example that they need to carry on. Some other issues that are very commonly experienced is loss of speech. Some types of dementia, and there are many different types of dementia that have many different symptoms. And the symptoms of some of the types of dementia are a loss of speech, aphasia, people losing words, losing sometimes the ability to speak. They can still think the words, they might even be able to write down the words, but they can't say the words. And a lot of times people will lose common words. And, you know, if you have experienced being in a conversation and you forget a word, you know, and it might make you feel uncomfortable because you know that word, you know what you're looking for. There's a word that means all of this, and somebody says it, you're like, yes, that's it. That's not dementia. You recognize that word and you can put the word back in. But if you forget the word spoon, you're looking at a spoon and you can't come up with the name spoon for that utensil. And then even when somebody suggests the word spoon, is it a spoon? A spoon doesn't really mean anything to them. Okay, that is what starts happening as people progress. And that's why they can't communicate to you what they want. And they end up getting frustrated and upset because they can't get the message across to you or what they're trying to say. There are also visual complications. We already talked about dim vision, where people can't see contrast, whether it's white food on a white plate or the white toilet in the white bathroom. They need contrast to be able to identify where the wall is, where the floor stops and the wall begins, and that kind of thing. And so when we talk about the dim vision, we want to remember better lighting in the home is important, whether it's natural light or whether you have lighting in the room, whether you install supplemental lighting on the walls so that it gives more the feel of daylight rather than just lamps on. That's important for people. They're going to function better if they can see better. Sometimes people experience what we call hemivision, and that is where they very dramatically only see half of their field of vision. And so you might, going back to this whole eating example, if your loved one has cleaned off half of the plate but hasn't touched the other half, they may be experiencing what we call hemivision. If you just spin that plate around, bringing the rest of the food into their line of sight, then they can see that and continue to eat. Small prints on clothing can be agitating for people sometimes. And I mean, like, you know, especially in the winter, you'll see these little like snowflakes or candy canes or Christmas trees or wreaths or something like that, little patterns all around on a shirt. And we think it's cute and we think it's festive, and yet we find, you know, grandma is just very agitated because the brain is interpreting those little things differently than what they actually are. And it may appear to be bugs crawling, and they may even look like they're moving a little bit. So solid colors are a much better choice for clothing for people as they advance with dementia. And that's not just on clothing, but it could be like sheets, solid color sheets, blankets, towels, upholstered furniture. Sometimes furniture will have little slubs of different colors or little tiny pattern on it. Cover it up with a towel if you see that they're having some kind of issue with that. If they think that there's a snake or something on there, don't try and say, no, it's not, it's just the pattern in the, say, I'll take care of that for you. Let me get you a different chair. We'll get rid of that one. We'll take care of that, and bring them something that is a solid color on it. Now, hallucinations are something else that I want to mention. Hallucinations are very common in Lewy body type dementia. Hallucinations are where people see something that is totally not there. They often see animals, typically puppies and kittens. They see little children playing, and they'll talk about the things that they see. So a caregiver's first reaction is often, there's nothing there. What are you talking about? I don't see anything. It's not there. Um, and that can be upsetting, obviously, for the person who's being told that, because either they are worried because they're seeing something that's not there, or they know it's there and you're telling them that it's not. So arguing with them and saying that it's not there is not the approach to take. One family told about their mother who was insistent on buying clothes for the children. And so they were coming to some sessions that I was having at a community center, and they talked about, you know, their mom talking about the children, and she needed to go and buy clothes for the children. And I thought, well, maybe she's back in her memory where she thinks her adult children are little kids. And so thinking about it in that respect, they went back and you know, they didn't try to reorient her and say, look, you know, I'm not a little kid. I'm 50 years old. But she was still talking about the kids. And then she was talking about the kids in the basement. And so they would take her down to the basement and show her that there were no kids in the basement. They didn't realize this was a hallucination that she was having. So then we talked about it further. And so they went back, and she's talking about the kids in the basement, and the kids needed clothing. And so they engaged her now about the kids rather than ridiculing her and saying there are no kids there. They tried to engage and talk about the kids. So it turns out that she had these children in the basement that she had to take care of because their mother was not a good mother. And so now she was responsible for taking care of them. There were no children there, but in her mind, this was the backstory to why these kids needed her. And they didn't have any clothes. She needed to go shopping for clothes. So I suggested that they take her shopping. So they went over to some store and they picked up some different clothing items for the kids, and they went home, and she was perfectly happy with that. She didn't dress the children. She never took the clothes out of the bag, but she was happy with the fact that she went and got the clothing. Then they went and took the clothes back to the store. So it was an activity indulging her delusion, yes, but it was calming her and helping her to feel more in control of her world. So if that's what we have to do to be creative, to go along with our loved one, to make them feel like they are in control and they know what's happening in their world, and that their reality is real, and that that we acknowledge it, and we are on their side. That's what they need to feel. So those are some ideas for interacting with those kinds of things. And so the last thing that I want to leave you with on this topic is as often as you can, take it back to how you would react to a young child. So if someone is having speech issues and they can't explain to you what they want, what do you say to a little kid who doesn't have words yet and they're trying to explain something to you and you don't know what they mean? We often say, show me. I have two little grandsons, and if I can't figure out what they're saying, I'm like, say, show me what you want. And they'll take me over and show me what they want. Other times I have come to understand, based on their behavior, what they're doing. They go to a certain cupboard and I know what they want in that cupboard. When their parents are at my house and they go to a cupboard, they'll say to me, "What does he want in there?" Well, I know what he wants in there. So we learn these things with little kids. Um, and we build this into our interaction with them. That's something that we have to learn to do with our elders living with dementia. We have to learn to observe what they're doing. Are they taking all the dishes out of the cupboard? We think, what is the reason for that? Maybe they just need something to do. People need to be productive. They need to do things. And so they may go and do things that seem really unusual to us. Or people just generally have different behaviors than other people. And we may not understand it because that's not how we do it. But if that's how they do it, they can't explain to us that's how they do it, but we have to go along with that and validate their feelings, validate what they're doing, try to work around it, try to be creative. We kind of have to be detectives. Um, in one living community, they talked about how this woman went from one room to another at night. It's all dark, everyone's gone to bed, but she would go from one room to another, just look in the room and close the door, look in the room and close the door. She had worked as a midnight nurse for many, many years. And so part of her routine was going in and checking on the patients. Yep, they're asleep in their bed. Yep, they're asleep in their bed. The, so letting her work through this, then she was able to settle down for the night. It's understanding that behavior. What does it go back to? Does what they're doing relate to something that they did for a living or that they did for fun when they were younger? Another gentleman, again, in a communal living situation, would go around and he would collect different things and he would deliver them somewhere else. And they thought this was just such strange behavior. What was happening? Turns out he was a mail carrier his whole life. And so he was delivering the mail. So they made a basket. They put letters and envelopes in the basket, and they let him just deliver them wherever he wanted around the facility. So it's that kind of creative thinking that we have to try to adapt in our caregiving journey. And that gives our loved one a better sense of themselves. They are more connected with who they are because of who they used to be. They feel in control of their world. That's something that we all want to do, is feel in control. So by becoming aware of these behaviors, what they mean for the person, and how we can accommodate them is going to make the caregiving journey much easier. Quality of life is going to be better for the caregiver and for the person living with dementia. So, just as a closing, don't argue with a person who's living with dementia. You're not going to win. Be in their reality. Be patient as you can, and observant. If you are a stop-by caregiver and you only have 5 minutes, it's probably better to go at a different time than to rush in and rush out. Looking for clues, body language, pain issues, those kinds of things. Knowing the person's history and background, and being part of a supportive caregiving team. Nobody can do this alone. It takes a lot of ideas. If there are other siblings in the family, grandchildren who can contribute, everybody's ideas can really help make for a more open, creative situation for everyone. So thank you. Take care, and I hope to see you again soon.